Is your tattoo increasing your risk of getting cancer?
Whoa, you're telling me tattoos are not only skin deep like beauty?
Well, stick around to the end and you find out. Welcome to Talking with Docs. I'm Dr. Brad Weening.
I'm Dr. Paul Zalzal. I always stay to the end.
Okay, yeah, you do. Okay, so tattoos. They used to not be very common.
Nope.
And now, actually, they estimate in North America here, 1 in 3 people have a tattoo, and 22% of people in Canada have more than 5 tattoos.
Come on, you have a tattoo?
No. Do you still have your lower back tattoo from university?
Had that removed. That was just a party that went awry. I never had a back tattoo to my wife. I'd be like that guy who asked for a 13, but they drew a 31.
Right, yeah, offspring.
Hey,
yeah, pretty fly for a white guy.
Audience
sorry.
could guess that.
Sorry about that.
You did.
So there have been some recent studies that have looked at the incidence of cancer, particularly 2 types of cancer. Skin cancer, which obviously is in your skin, and then lymphoma or blood-borne or lymph-based cancers.
Yeah.
That the incidence might be elevated in people that have tattoos, and whether or not this is more just a super loose association or whether it's causative, whether it's causation. We talk about this on our channel all the time. Just because you have something and say you have 2 things, it doesn't mean that they are causing each other.
That's
a really important thing in medicine.
Yeah, when we're doing studies.
Right. Okay, so where does a tattoo go? What's a tattoo?
Yeah, we should really talk about skin. If we're going to talk about tattoo, we have to talk about skin, okay?
Yep.
And skin is basically 3 layers. I'd say the epidermis, the dermis, and then the hypodermis, or we call it the subcutaneous tissue.
Yep.
The epidermis is that outer layer. It's made of squamous epithelial cells, squamous stratified cells, right? So they're layers of cells. The bottom layer, the basal layer, is just making more cells.
Right, that we shed.
As they migrate up to the top layer, they shed.
Yep.
Okay, and actually 20 to 50% of your household dust is made of skin. Did you know that?
It's pretty gross.
You're dusting yourself.
So gross.
The rest of it's like pollen and fiber particles and stuff,
Sure.
but a big chunk of dust is you in your house, okay? Because you're shedding off skin like a snake, except a snake does it all at once.
Right.
We do it every 28 days or so,
Yes.
okay? That's your epidermis. That's not where the tattoo lives, all right? The tattoo lives in the dermal layer.
Right, because if you had a tattoo in that layer, you would lose your tattoo like every 28 days.
I want my money back.
Yeah, where's my
Paid a lot for
tattoo?
this. Actually, some tattoos do live there. Those are the henna tattoos, the temporary tattoos.
Right.
And the ones we used to get when we were kids, you know, you slap it on, run it under some water. Did you ever get those?
Yeah, so actually I did, my wife and I were going to Hawaii like 8 years ago, and as a joke, I did a whole sleeve.
Of those temporary tattoos?
Yeah, and then I took a picture for my kids, and they're like, what the heck is going on? And then, because I was going to do like a little social experiment and then keep it and see if people treated me differently.
Yeah.
And then I had to take everything.
Yeah, to scrub that off.
Yeah, but they're really good nowadays, actually.
The fake tattoos, the temporary tattoos.
Yeah, they're very realistic.
Well, they live in the epidermis, right?
Yes.
That's why they shed off. Now, the dermal layer, unlike the epidermal layer, there's less cells in there, different kinds of cells. These are more fibroblasts, things that make collagen. The cells live in a collagen and elastic matrix. That's what makes your skin go whoop and back
Stretchy.
again. Yeah, except when you age, you get less collagen, less matrix. And then there's some Langerhans cells, some immune cells that live in there too.
So if you skipped histology, you're welcome.
Yeah, and that's where the tattoo lives.
Right.
The modern day tattoo lives in that dermal layer.
Right.
So the ink goes in there. The ink is engulfed by macrophages. They don't know what to do with it, these immune cells. They just hold on to that ink, and that's why it stays there.
Right.
But over time, it breaks down.
And so the issue obviously is the risk. We're going to talk about that in general. A little bit the process, but really we're talking about the ink. Really is the problem.
Okay.
Right?
Now what is the ink?
Yeah. So some of it is referred to as like carbon soot.
Yeah. Older
like the black part, and then sometimes there are heavy metals in there. Sometimes there are other dyes. It seems like the red dye is particularly concerning.
Okay, so
sorry, Canadians.
Right.
I guess Americans too. They have a little bit of red,
we have
but
more.
we are all red.
Yeah, and so those dyes nowadays contain things like that are in paints and industrial applications and so
like volatile organic compounds
and heavy metals.
Yep.
So bad stuff can be in that ink, but it's not a big deal, you would think, because your body just engulfs it, keeps it there, nothing happens.
Yep.
However, over time, those macrophages eventually die, and the new macrophages come in, and some of the ink is lost and circulates away.
Ends up in the bloodstream or the lymph, and then localized in these little lymph nodes.
Yeah, and now red is irritating just because of the chemicals they use for red.
Yeah.
All right, so that's skin. That's what's in a tattoo. That's how they go together.
What I'd say about ink is that it's much more regulated than it used to be.
It's not super regulated.
No,
though.
it's kind of like FDA regulated.
Yeah, you're not. You're
Probably
not.
more like if a bunch of people complain and said, hey, I got cancer on my tattoo, the FDA would be like, let's go check out this tattoo
Yeah,
parlor.
yeah. Well, plus when you get a tattoo, they're not listing all the ingredients. Possibly there's some ingredients in there that you don't know about.
Right.
Okay. So then that's that. So then usually everything goes over. There's some bad things can happen when you get a tattoo. We were talking about this earlier.
So when you get a tattoo, this is an invasive, like pseudo medical procedure, right? Where your skin is being penetrated, just like if you went to the operating room and had surgery. There are risks. So first thing, you could have just a superficial reaction of your skin, or even an allergic reaction to the compounds that are being injected.
Especially those red inks and things like that, because they have more allergenic.
Thankfully, quite rare, but still possible and could be severe. Theoretically, could be life-threatening if you had an anaphylactic reaction to it. And especially you wouldn't know. Like it's not like you're routinely getting exposed to these dyes until you had it.
And it can happen later. It doesn't have to happen right away.
That's right.
I had this tattoo a few years ago. Why am I getting an allergic reaction now? That can happen.
Right.
The immune system becomes compromised.
So that would be the first thing. And then the next thing, anytime the skin's ever penetrated, theoretically, it would cause an infection. So that infection could be caused by a bacteria, by a virus, or by a fungus. So we all have bacteria that live on our skin. So typically, this should be done in a sterile setting with sterile instruments, and your skin should be clean rather than taking the bacteria that's on your skin and driving it deeper, because our skin acts to protect us. So you could get a staphylococcal or a streptococcal infection. That would be the bacterial side.
And as surgeons, we worry about this
all the
a lot
time
when we make an incision, because it's the exact same risks as when we make an incision.
Right. So other than using a sterile prep, I don't believe a routine tattoo would require preoperative or pre-procedure antibiotics.
No, they don't use perioperative antibiotics,
Right.
but you should have proper sterile technique, disposable instruments.
Single-use disposables.
And the best way to minimize the chance of something like that happening is going to a reputable place. Now, that's not all the infections. You mentioned bacterial.
We got kind of sidetracked. So I'd say viral is the one that probably people worry as much or maybe more about. And the big three viruses would be hepatitis B, hepatitis C, not hepatitis A unless they have a shrimp ring off to the side. That's maybe been known for a while.
B, C,
and
HIV.
Hey, did you know that rhyme?
HIV. No, I just
You just made a rhyme right now.
Yeah.
So
it's a good way to remember it.
So these are very uncommon infections when you have a surgical procedure or an invasive procedure, like 1 in like 100,000 and certainly even up to like 1 in a million. Very uncommon, but this can happen. And that same thing can happen if you have a dental procedure, if you had an outpatient colonoscopy, whatever, a surgical procedure, if the instruments were not cleaned properly or reused or whatever.
So always a reputable place if you're getting, never at Brad's basement where he got his sleeve.
That's right, yeah. So there's no penetration of the skin, but yes, 100% reputable company. Look, Better Business Bureau, maybe if they've had health warnings or violations, maybe consider going somewhere else.
Yeah.
And then the last one would be a fungal infection, also along the same lines. It's just something that lived on the instrument that was penetrating your skin and driving it deep.
Right. Okay. So those are risks that can happen. However, if you go to a reputable place that's using proper sterile technique, the chance of that happening is very, very, very low.
Really low. Okay, let's go to cancer, which really is why people are probably here. You're like, man, I got 4 tattoos now. Should I have them removed because I'm worried about cancer?
Yeah.
Okay, so
an anchor, as you put it.
Right. So we talked a little bit about how back in the day, people, particularly men that were going away in the Navy, I think probably from boredom is my guess. A little anchor on the forearm. It was typically a smaller surface area, probably with more dangerous materials, realistically, right?
Maybe not. Maybe it was just soot back then, as opposed to some of the industrial chemicals we used.
Fair. Not regulated.
You don't want to be that guy on the ship with a red anchor.
Well, you might have a red anchor for the first little while as your body fought off the superficial infection. But nowadays, people are getting not only bigger tattoos, so the size of your palm, we're going to talk about this in some of the studies, so not only bigger surface area, but also more tattoos, or entire sleeve of your arm, or your leg, or your entire body. There are people that have their entire bodies. I remember when in the 80s when the Guinness Book of World Records was a common, almost like a Christmas or birthday gift kind of thing, and there was always like the dude who had the most tattoos. Essentially his whole body was tattooed. And there was like a few of these people in the world. Now, that's just a Tuesday downtown.
Now that's social media.
Right, like a Mike Tyson.
Okay, so what is the deal? Is there an increased risk of cancer? Specifically, we're talking about cancers like skin cancers and lymphoma.
Let's start with skin.
Okay, skin cancer. You would think, hey, well, this thing lives in the skin. There's lots of weird chemicals in the inks that they use.
Yep.
there should be a higher incidence of skin cancer.
And cancer is more common in areas that are commonly reproducing. So we just mentioned how your skin is shedding all the time. So cells that proliferate a lot, they have a higher chance of making a mistake or being vulnerable to some type of insult, leading to a cancerous tissue that then could be selected for and then selfishly grow more. So there's a bunch of different kinds of skin cancer. We're mostly talking about melanoma and squamous cell. Basal cell seem to not be related at all. So let's talk about the one study that more recently was up and really brought this back to light.
Are you talking about the Danish study?
Danish study.
Yeah, Denmark. Thank you very much.
Yeah,
Denmark,
thanks,
for
Denmark.
producing this excellent study.
Sorry that you're in the news for other reasons.
Right. You got a lot more to worry about right now than tattoos. We get it.
Yep.
But this study came out of Denmark, and it was basically a twin study.
Which are very good studies.
And rare.
What do we like about twin studies?
Twin studies are good because they control for the genetics, because you have two individuals that are genetically identical.
Right.
And so then you're really eliminating that bias from the study itself.
The nature part's controlled. It's all about the nurture.
Yeah, exactly. Yeah, good way to put it. But that's super hard to control, the nurture part. But in any case, so they did a study where they looked at twins who were discordant for tattoos. Means one twin had one twin did.
Yeah.
Probably so their mom could tell them apart.
Right.
No, probably not for that reason. I just thought of that. Right. They didn't put that in the study. No. So, and what they found was, hey, look, there's an association between having tattoos and skin cancer.
Right. Yeah, and what's neat about Denmark and a lot of countries, they had actually a twin registry. So they just literally went and said, okay, let's find all these twins, contact as many as we can, find out who had cancer, and then compare.
Okay, and what's the main thing we always want people to understand when you're looking at one of these type of cohort studies?
Is that it doesn't prove that getting a tattoo causes cancer.
It's not causation, it's an association.
Right.
Okay. So someone could say, well, maybe the people that got the tattoos like to show them off more, so they wore short sleeves, their shirt off, they walk around in the sun, and that did it.
Yes.
Right.
Or maybe there's a whole bunch of reasons.
Go to the beach more.
Other factors that can contribute to cancer are not controlled.
Right.
That's why it's an association. Obviously, the stronger the association, the higher the chance that it is a causation.
Yeah.
But you can't prove it unless you do a randomized controlled trial where you're contrling all variables, and that's simply not possible.
Yeah. Not with a tattoo study anyway.
Right. So
but they found an increase.
Yeah. What kind of increase? Like how much are we talking about?
Was it like 1 point something or other? 1.3?
Yeah, like a 30 to 50% increase. So so real relative risk increase.
Yeah, not huge, and the confidence intervals on those were quite large. So it wasn't a very accurate association, but it just showed an association that wasn't very strong.
Right. And likely related to the volatile organic compounds that are put in, possibly related to the heavy metals that are put in, possibly related to the dyes. Or the other one that makes even intuitively more sense to me is that the larger your surface area, the higher the chances that you will miss or have a late diagnosis of skin cancer.
Yeah.
Because you can't see it. It's like, find the mole.
Yeah. Why'd you get a tattoo of a mole? Oh my God, that's not a tattoo.
And that's why they say, actually, if you are going to tattoo, you shouldn't tattoo on a mole, or you should be aware of the geography of your moles.
Don't tattoo anything that looks like a mole.
Right.
Right? So, it's camouflage for the mole.
Okay, so the take-home message for skin cancer is maybe.
It's weak association, but there's an association, and I think all it tells us is we need to do more research to answer this question.
Yeah, and I think they also found that the risk was higher not only with having a tattoo, but also the number of tattoos and the surface area of the tattoos.
Right.
Which also makes sense.
Fair. Oh yeah, fair. Okay. And now lymphoma.
Lymphoma. So what kind of cancer is lymphoma?
Lymphoma is a cancer, blood-borne really, lives in the lymph nodes.
Yeah.
And this one's a bit more daunting because they have found evidence of tattoo ink in lymph nodes that are far away from the tattoo.
Right.
Indicating that, some of this ink didn't just stay in the dermis. It went into circulation for a brief period of time and got captured in the lymph nodes.
Right.
And so the idea there is that these toxic materials that live in the lymph nodes can, over time, lead to a cancer in that area.
Right.
And there was an association there as well in the twins. And this one was a little bit stronger, actually, than the skin cancer. I think it was up over 2.7, something like that.
Right.
And there's other studies as well that you had found that did also show that association.
Right. So the incidence of lymphoma in the general population is about 2 in 10,000, give or take. Mm-hmm. And with the risks that were associated with these studies, it increased it to, say, a 3 to 5 per 10,000. So like 2 to 3 to even 4 times increased risk of cancer. So thankfully, this is a very uncommon cancer.
Yes.
So the relative risk is very high, but the absolute risk is real but low.
So that's we've talked about this before. The difference between an absolute risk and a relative risk. An absolute risk is your risk in the general population of getting something. A relative risk is how much higher your risk is. Right. So you can have a really big relative risk increase, like 5 times. Yeah. But if the incidence of the problem is 1 in a million, now you're 5 in a million, it's like, it's still pretty low.
That's right.
So that's why you were saying it's 2 in 10,000 typical for lymphoma. Now with this association,
maybe 3, maybe
could be 4, could be 5, which is still very low, but increased compared to if you didn't have the tattoo.
Right, and again, still association, not causation.
But worthy of further research.
Right, so what's the take-home message?
Maybe it causes cancer.
Right. So if you said my only goal in life is to avoid cancer, I'd say don't get a tattoo.
That's a good point.
Right?
Yeah.
Like if you said I have a really high risk of lymphoma, I have a strong family history of skin cancer. Realistically, your family history is probably related to sun exposure, melanoma. However, if you said, listen, I only care about avoiding cancer in my life, I'd say don't get a tattoo or get a different kind of tattoo.
That's a good point. If you have a history of lymphoma in the family or a history of skin cancer in the family, think twice. Right. What about lasering it off? Do you think that reduces your risk? Never been studied, but.
Yeah, so I don't really understand exactly how the laser gets rid of it.
Laser breaks down those inks, and so they get.
So for me, I would wonder if it would increase your risk of something like bladder cancer, because they've looked at bladder cancer in these Danish and Swedish studies, and the incidence was not high enough to be statistically significant. So my concern is if you're breaking it down, it has to get out of your body some way, and often there are victims along the way. And usually it's your bladder. So
or your lymph, if you end up in your lymph nodes, because you break it down into smaller ink particles.
Yeah, because it's not pulling it out.
So I'd say there's never been studied, but I say no. I don't think the lasering. So if you see this video, like, oh my God, I want 0 risk, I'm gonna go get my wings or my mom lasered off or whatever you had there. Yeah. It's probably not going to change your risk, in my opinion.
Yeah, I would agree with that, and it might even alter it a little bit because it's going to get that stuff mobile. Yeah.
Amputate.
Yeah. Well, no, that would be the answer. I guess you have to cut.
It's extreme. Yeah. It's extreme based on this video.
Yeah. Okay. Okay, so if you have a tattoo, if you had a tattoo, and unfortunately if you've had cancer, or if you're concerned about this, leave a comment. Let us know. Share your experience. Share what your tattoo. Actually, how about this? If you have a tattoo, share with us what you got a tattoo of, because I'd be very curious to hear what people are getting tattooed on their body.
Tell us what you think funny. I know what the funniest tattoo I've ever seen is.
Okay.
It was a patient, and he had on his forehead tattooed, "Have a nice effing day."
Oh, gee whiz.
Yeah, it was harsh. Yeah, it's kind of the first thing you look at.
That's hard to get a job when you have a tattoo like that.
Yeah, it's hard to get a partner, too.
That's interesting.
Yeah, there you go.
Unfortunate.
I don't think he did it. I think he was a gang member, and I think they did it too.
They made him?
I think that may have happened. I'm not sure.
That's a mean gang.
Yeah, he's no longer with us. God rest his soul. But it was about 25 years ago. I remember seeing him as a resident.
Yeah.
Pulling the curtain back in the fracture clinic. It's like, whoa, yeah.
Okay.
Did you see? Can you top that tattoo?
I definitely cannot top that. But now, if you like this video, please like it. Subscribe to our channel, share your experience with tattoos, and share this to someone maybe that's thinking about getting a tattoo, is really worried about the cancer, and then they can essentially decide for themselves.
What would you get if you got a tattoo?
Maybe a Canadian flag. I'm proud to be Canadian.
Yeah,
I really don't. I don't know.
I like the medicine symbol. I get the medicine symbol.
Yeah.
Till I retire.
That's right.
Remember, you are in charge of your own health.
We'll see you next time.